This is the Phoenix PCN patient education video on menopause. My name is Maisha. I am one of the physician associates working with Phoenix. I am in my fourth year of working with a current focus on menopause. Menopause is a normal part of aging, a phase all women go through that can unfortunately cause a lot of distress for some. It can impact their quality of life due to how severe the symptoms can be. And so I hope that you can benefit from the information provided today. Let's begin with what menopause is. So menopause is the absence of your period for at least 12 months or more while not on hormonal contraception, not due to pregnancy or any other medical condition. It occurs due to the natural loss of egg cells over time with aging, causing low estrogen levels. This image on the right illustrates this. So for example, you have your egg cell here. Your egg cells sit inside your ovaries on both sides of your pelvis. And it's these egg cells that produce the key hormone called estrogen. So your ovaries are actually the main producers of this hormone. As you age, you lose your egg cells, and when you reach the age of around 45 to 55 years old, this is the average age for menopause, this drops significantly, and therefore the level of estrogen drops significantly. The low estrogen levels is what causes the symptoms of menopause and perimenopause. The reason for this is because estrogen is important for so many different processes all over the body, and that's why the symptoms can be quite non-specific and difficult to diagnose. Perimenopause is the stage leading up to menopause. The symptoms usually last a few years, and this is when the periods don't stop completely. However, they may slow down, they may become more frequent in some, they may become less heavy. And we can discuss more of the symptoms of perimenopause and menopause that you may or may not be going through in later slides. This image helps us visualize those changes. So you have your estrogen levels in the reproductive years rise and fall with each period. It's very predictable and very regular. In the perimenopausal stage, the egg cell count drops significantly, and so the hormone levels and the periods are very irregular, very unpredictable. In the postmenopausal stage, you're getting no periods, the egg cell count is significantly low, and so the estrogen level falls to almost zero. So what are the symptoms of menopause and perimenopause? Well, patients often present with hot flushes or night sweats, chills, irregular periods in perimenopause, sleep problems, dry skin, thinning hair, vaginal dryness, and mood changes. Vaginal dryness can also present with pain during intercourse, pain when peeing, feeling the need to go to the toilet quite often, and also urgency to go to the toilet. Other symptoms not mentioned on here include fatigue, headaches, muscle aches, joint aches, palpitations, pins and needles, ringing in the ears, weight gain is very common, and brain fog is also very common, so forgetting things that usually you'd remember. Clinicians often only need your symptoms paired with your age range, so above the age of 45 years old, to diagnose menopause and perimenopause. However, if you are under the age of 45 years old, you may need some blood tests and further investigations because this would be classified as early menopause. And so it's more highly recommended if you're in this age range to have the medical management for menopause. So what is HRT? HRT stands for hormone replacement therapy. It works to increase the level of estrogen in your body, and that way it treats the symptoms of the low estrogen that menopause causes. So there are a few different ways you can have this estrogen. You can have it through tablets that you swallow. You can have it with patches that you put onto your skin. You can have it via creams that you apply onto the skin, and the estrogen is absorbed this way. Or you can have it intravaginally. The intravaginal options usually treat the local symptoms of irritation, dryness, pain during intercourse, and urine infection type symptoms that we mentioned earlier. HRT treatment is slightly different in perimenopause and menopause. However, the main thing to remember is that if you have a uterus, you should have combined HRT. So that's estrogen component with the progesterone component. If you do not have a uterus, you should be offered estrogen only HRT. Like with any medication, there are risks as well as benefits. Risks of HRT include clots in taking the tablets, which your healthcare professional will assess you for. There is a low risk of breast cancer, ovarian cancer, and endometrial cancer, although the risk is very low. And if you're under the age of 60 years old, you're having menopausal symptoms, and you're not at high risk of any of these issues, then usually the benefits outweigh the risks. The benefits include relief of all of those symptoms that we mentioned earlier, preventing osteoporosis, which means weakening of the bones, and related fractures as a result of this, reducing the risk of heart disease if you start the HRT within 10 years of menopause, and also in maintaining muscle mass and strength, seeing as menopause does cause a loss in both of these things. This is a list of conditions that mean you are not able to have HRT. So for example, past, current, or suspected breast cancer, known or suspected cancer of the breast, the uterus, or the ovaries, if you have undiagnosed vaginal bleeding, if you have untreated thickening of the uterus, if you have had previous or current clots in the lungs or your legs, if you have active or had recent angina, heart attack, or stroke, if you have liver disease, if you are pregnant, or if you have any clotting disorders. If you experience postmenopausal vaginal bleeding or persistent bleeding while on HRT, you need to speak to your GP immediately. This is because any bleeding after menopause, so after your periods have stopped for 12 months, is a red flag symptom and it can sometimes be a sign of cancer. Bleeding while on HRT can be normal for up to 4 to 6 months. However, after 6 months, you should not be having any bleeding and you need to get this checked. Other ways to help manage your menopausal symptoms include increasing exercise. Increasing exercise helps with hot flushes, it reduces the risk of heart disease, and it also helps with weight loss. Swimming is recommended because it alleviates the pressure on the joints, and strength training is very highly recommended because it increases muscle mass and it also increases bone strength. Reducing stress helps to reduce the stress hormone called cortisol. You can do so via methods of meditation, yoga, deep breathing, and Tai Chi. I'll leave leaflets for these at the end of the presentation so you can read this in your own time. Improving sleep hygiene helps if you're having sleep problems. So some examples of sleep hygiene include going to bed at the same time every day. It includes making sure that the room is nice and quiet, that it's dark, that it's a cool temperature, making sure you limit your caffeine intake, so not having caffeine anytime after 5 p.m. It's exercising earlier during the day, it's having a warm shower in the evening, winding down. Sometimes aromatherapy can be beneficial, for example, lavender can help induce relaxation. And I'll leave a leaflet for this as well at the end of the presentation so you can read a lot more information in your own time. Stopping smoking helps because smoking worsens hot flushes. Smoking also worsens bone loss and it also worsens heart health. Vitamins, especially vitamin D with K and calcium for bone strength, and magnesium. There is evidence that magnesium can help to support brain health, hormone balance, and mood stability as well. Limiting caffeine and alcohol will also help limit your hot flushes and also help to stop sleep disturbance. You may want to make changes to your diet to help manage the symptoms of menopause. For example, isoflavones and black cohosh has been shown to relieve hot flushes. Phytoestrogens copy how normal estrogen works, and so having foods rich in phytoestrogens such as soybeans, tofu, flax seeds, sesame seeds, and chickpeas can help relieve all the symptoms of menopause. Hormone balance, brain health, and mood stability is supported by omega-3 fatty acids. So you can take this via supplements, or you can incorporate salmon, sardines, walnuts, chia seeds, and flax seeds into your diet. Protein is very important to maintain muscle mass and to increase metabolism, which we know slows down with menopause. So having foods like beans, lentils, eggs, fish, and chicken can be highly beneficial. Calcium-rich foods are also recommended for bone health. So for example, low-fat dairy, tofu, sardines, and leafy green vegetables. Reducing inflammation and insulin spikes is important because insulin spikes and inflammation will worsen mood swings and increase weight gain. So reducing your refined carbs and sugar will help. Increasing your fiber will help to stabilize blood sugar and help support your digestion, which also slows down with menopause. So having foods such as vegetables, more fruits, whole grains, and legumes are highly recommended. In addition to diet and lifestyle changes, as well as HRT, there are non-hormonal treatment options such as SSRIs and SNRIs to help control hot flushes and night sweats. These are antidepressants, so they help with mood, but they also help better control of temperature in the body, which is dysregulated in menopause. So these are good options if you are not eligible for HRT or you've tried the diet and lifestyle changes and they haven't worked for you. This slide helps us to understand why you experience those mood changes with menopause. So it's that falling level of estrogen that causes feelings of irritability, low mood and anxiety due to dysregulated serotonin hormone. Serotonin is known as the happy hormone, and so less of this means less mood regulation. Decreasing estrogen can also impact other hormones like cortisol. It increases cortisol and therefore can increase feelings of stress. Other menopausal symptoms such as the hot flushes, night sweats, and poor sleep can also contribute to feelings of sadness. This slide goes into details about the symptoms you might experience down below. So for example, burning or itching inside your vagina, pain during intercourse, unusual vaginal discharge, usually a yellow color, spotting or bleeding during intercourse, vulval itching, so that's itching around the outside area of your genitals, frequent urinary tract infections. This happens because the lining thins out and there's less lubrication down below, and so bacteria can enter a lot more easily. Being unable to hold your pee, peeing more than usual, painful urination, and blood in your pee, again occurring because of that thinning out of the tissues. All of these symptoms are very important to get checked just to rule out any other causes, but they can be due to menopause and they can be treated with the estrogen creams or estrogen pessaries, which are like tablets that you pop up there, or estrogen rings. These forms of treatment don't hold any risk of the breast cancer, ovarian cancer, nor endometrial cancer, so they are very safe and they can relieve symptoms very well. So I'd highly recommend it if you are experiencing any of these symptoms. It is important to note that you can still be fertile for 1 year after your last menstrual period, or 2 years if you are under the age of 50 years old, and so you do need to use a form of contraception if you are sexually active. HRT is not a form of contraception. Thank you for listening to this educational video on menopause on behalf of Phoenix PCN. Here are some links to reliable resources for more information.